Logan Marshall is a fast-moving, thriving 2-year-old with a big smile and a whole lot of energy. What you may not notice, he's living with a genetic condition called NF1.
It stands for Neurofibromatosis type 1, and it's primarily a disorder that causes tumor growth and then skin changes. It's the main things we see. So we can get development of, we call cafe au lait spots, which are birthmarks across the skin, some certain eye findings, and then what we monitor for especially is the tumor growth. Majority of the time the tumors are not cancerous, but when we're talking about brain tumors, there's only so much space in there. So we monitor very closely for those, and then we can start treatment with medications if we do start noticing them or start noticing changes associated with that.
Sanford Health pediatric genetics specialist Dr. Rachel Lee is Logan's doctor and says these types of conditions, starting with birthmarks, can run in the family.
We actually saw Logan when he was just a little baby. His mother had been diagnosed with a different genetic disorder called McCune-Albright, also associated with birthmarks. And then they noted the birthmarks on Logan. And Logan has a half-sibling who also has NF1, so there was already concern in the family for NF1. So they got referred to us, and we sent genetic testing, and we diagnosed Logan with NF1. We then did family follow-up testing, so we tested the siblings, and then we tested Dad, and Dad was found to have NF1 as well, and he did not know about that beforehand. And then multiple siblings were also affected, so we see them all in our clinic now.
It was through a unique clinic. Mom and Dad, Candace and Roland, learned more about NF1.
I think we were one of the first families, a part of the NF1 clinic.
The Neurocutaneous Clinic is a multidisciplinary team of pediatric specialists at the Sanford Children's Specialty Clinic, including Dr. Lee, along with neurology, hematology, oncology, child development specialists, therapists, ophthalmology, and more who see patients just like Logan and now his sisters too. It is the only clinic of its kind in the area, so the Marshalls are thankful for that convenience of care close to home.
I think everyone's so excited about the new clinic, and everyone's just been very passionate towards us. They're always here to help us when we need anything. Just send a portal message and a nurse calls you, or you have social work available to you. They help line up everything so that if you need something for each kid, that you can come at the same time and not have all of these individual appointments. So that's been very helpful.
I think the biggest thing I found coming to Sanford was just how collaborative all the physicians are and the providers. I feel like that's a really unique thing to find, is everyone's just here to focus on what is best for patient care, what is best for the children, and if that means creating an entire new clinic for families, that's something that they're going to go forward with and do. I think having us all in the same building together, again, if I have a question, you just walk down the hall and you ask a provider. I have a patient that needs to be seen a little bit more urgently or has traveled 6 hours and I want to get them on. I can just go ahead and ask, and people are more than willing to accommodate. So that's been, I think, the huge benefit.
It is a convenient one-stop specialty clinic for families, especially patients like Logan Marshall, who is always on the move. For Sanford Health News in Sioux Falls, I'm Courtney Collin.